My name is Chris Girdler, President and CEO of SPEDA, which stands for Somerset-Pulaski Economic Development Authority. I was born and raised in this community, and as many people have heard me say in the past, I go back 7 generations in Pulaski County. So it's just an honor for me to come to work every day and really get to do something that comes second nature. My wife, Courtney, and I both reside here in this community, and we have 2 young daughters, Charleston and Channing, who are both growing up in the local school system here. A little bit of background of my diagnosis of Cushing's disease. It was something that obviously came about over time, but was diagnosed pretty quickly by the expert medical team here at Lake Cumberland Regional Hospital. I had been feeling very fatigued and just off, experiencing a lot of various health issues for some time, for several years. And honestly, I just kind of chalked it up to this is what getting older feels like, this is my new norm. It was after a couple of consultations with my good friend as well as physician, Dr. Brent Cherry, that he just said, Chris, we have got to do a deep dive into this. We need to get to the bottom of it.
The way that his labs presented were not the usual case for, say, low thyroid function or low testosterone or just abnormal hormone levels. We talked about treating those levels and the fact that if we did start some sort of treatment, it could mask symptoms or the underlying diagnosis going forward. So we decided to consult Dr. Joseph, endocrinologist. Credit to Dr. Joseph. I mean, in the face of seeing normal cortisol levels, he had to do further testing.
Cushing's disease is one of the hardest things to diagnose in medicine, and that's for a couple of reasons. The symptoms that a patient has with Cushing's disease includes things that are very non-specific, things like a progressive increase in weight that's concentrated around the abdomen, depression, difficulty concentrating, high blood pressure, diabetes, things that we commonly see in a lot of people. Collaboration between physicians, having an interdisciplinary team of doctors is extremely important.
It is actually a great responsibility when you see patients with such a problem. We found out that he has a pituitary tumor, and the pituitary tumor was about 7 millimeters in the middle of the pituitary gland. So these tumors are a little bit very delicate to take care of it, because essentially we need to remove the tumor and preserve the normal pituitary gland. Of course, we work here as a team, and Dr. Vaughn, who is the ENT, has a very great experience in helping me with the approaching these tumors. He did a very good job. His surgery went very well, and I'm delighted to see how well he has done after his surgery.
I can't say enough high praise for the experience. Quite frankly, from top to bottom, from beginning to end, and that goes from the registration to the pre-op to the surgery itself, spending a week on the NICU floor, having those expert nurses there caring for me on a 24/7 basis. I just cannot give enough high praise. I have the utmost confidence in that entire team. Lake Cumberland Regional Hospital will forever just have my sincere gratefulness. I've always tried to keep a positive mindset on life, no matter what the ups or downs may be. But the way that I viewed the medical procedure and the recovery since all of that was that God has allowed me to kind of hit that reset button. Now that I have recovered from that, still in the recovery process, but getting better every day. The good days are far outweighing the bad now. But the more I recover, the more I'm finding the joy in those things that once were.